It's my pleasure to introduce Dr. Beth DeGrush, who's the Program Director of Neuropsychiatry, who will introduce today's speaker.
Thank you. Good afternoon, everybody. I'm very happy to introduce Dr. Andrew Budson. I'll give you a quick overview of kind of his credentials here, which are quite impressive. I will begin by saying he's the Chief of Cognitive and Behavioral Neurology and Associate Chief of Staff for Education at the VA Boston, as well as Associate Director and Education Core Leader at Boston University's Alzheimer's Disease Center, Professor of Neurology at Boston University, and Lecturer in Neurology at Harvard as well. I will mention that his training includes graduating cum laude from Harvard, being a chief resident in the Harvard Longwood Neurology Residency Program, pursuing a fellowship in dementia at Brigham and Women's, and studying memory as a postdoctoral fellow in experimental psychology and cognitive neuroscience at Harvard University. He was awarded the Norm Geschwin Prize in Behavioral Neurology and Research Award in Geriatric Neurology from the American Academy of Neurology. And you may have noticed that we have mentioned that he's a researcher, a teacher, and a clinician. And I mentioned neurology multiple times. For any of you who know me, I'm very excited that he is speaking for the psychiatry grand rounds. And I think that we will all find something to take away from this, neurologist or not. And I will also say, and I just told him this, that in my office, when I see patients and families struggling with memory problems and dementia, I frequently pull out his book, 6 Steps to Managing Alzheimer's Disease and Dementia. It's written beautifully for families, and it's extremely approachable, so I pull it out all the time. As mentioned, the talk today is consciousness as a memory system, and I can't imagine something more relevant to all of us in the work that we do every day with patients. So without further ado.
Well, thank you. Thank you so much for that very kind introduction. So it is my pleasure to talk with you all today about this work that I did with my colleagues, Elizabeth Kensinger, who is a experimental psychologist, and Ken Richmond, who is a philosopher. And if you're interested in this and you want to learn even more, you can see this work has been published last December. It's actually out less than a year in the Journal of Cognitive Behavioral Neurology. These are my disclosures, which is mainly that I like to write books and do a little bit of work for some companies. So when you think about consciousness, some questions come up, such as, why did it develop? What does it do? What is it good for? And why is consciousness so difficult to control? In other words, why is mindfulness so hard? And are your actions under your conscious control? And if they are, how come dieting and resisting other urges is so difficult? Can you drive and do other complicated types of activities without conscious awareness? Are animals conscious? Are there developmental, neurologic, or psychiatric disorders of consciousness? And why does consciousness feel like a continuous stream, which is quoting from William James? Because isn't the brain actually processing massive amounts of information in parallel? So does consciousness actually flow linearly with time? And the answer is actually no. Consciousness does not flow linearly with time. And we know from a class of effects that are known as postdictive effects that a later stimulus, something that happened after, can affect the perception, the conscious perception of an earlier stimulus. So William James actually gives the example, actually translating Exner, when we are deeply absorbed, we may not hear the clock strike, but our attention may awake after the striking has ceased, and we can then count off the strokes. So were we conscious of the clock striking or not? And we've all had the experience when we're talking at a cocktail party and we hear our name in another conversation, and we can actually remember the earlier part of the sentence in which our name was mentioned. You know, how is that happening? Were we conscious of that or not? And we know from experiments that this is a real effect. The classic example in experimental psychology and things like I do with memory research is backward masking. If you show a face for just a brief number of milliseconds, you can see it. But then after the face is shown, you show a mask and then it's invisible. If I showed you a red disc for 20 milliseconds, you could see it. But if I show you the red disc followed by a green disc also for 20 milliseconds, you don't see a red disc followed by a green disc. You see a fused yellow disc. And in this very interesting effect here, if I flash up a red dot in one place and then 100 milliseconds later, a blue dot in a somewhat separate place in space, you don't see the red dot disappear and the blue dot appear. What you actually see is the red dot moving toward the location of the blue dot. And in the middle of this motion, it transitions, not at the end when the blue dot appears, but before the blue dot appears, it changes blue. And this effect is actually the basis of how we see motion pictures, why it seems like the motion is smooth, even though our visual system can actually see each individual frame if they're simply shown separately for the same amount of time that they're shown. These effects don't only happen in the visual domain, they actually happen in the auditory domain and in the tactile domain as well. If I was tapping 5 times in your wrist, 3 times at your elbow, and twice at your shoulder in rapid succession, you would feel a little creature crawling up your arm, and you'd feel intervening little feet between the taps. Now, perhaps from everything that I've told you so far, it might not surprise you that the brain can actually detect whether or not a number was present then followed by a mask, or whether the number was omitted. You can see that between 200 and 270 milliseconds, the brain can tell, which we can detect using EEG electrodes. But the individual can only sometimes be able to detect whether the target was there or not. So why is it that the brain is detecting these things, but our conscious perception is not? And this type of issue or problem comes up in the motor domain as well. Benjamin Libet first did an experiment that has now been replicated many times. He asked individuals to simply make a motor movement whenever they felt like doing it, and to note the time that they made the movement on a special clock that could be able to have people measure it with millisecond resolution. And what he found is that the conscious decision that people use to move actually occurred about 350 milliseconds after their supplementary motor cortex was beginning to plan this move, so that the motor cortex is going first, then they're consciously deciding to move. Something similar happens with perception in what's called chronostasis, which is this very interesting phenomenon. So if I took my cell phone and I quickly moved it from one side of the room to the other when the video camera was on, you would see a blur. But if you make a saccade with your eyes from one side of the room to the other, you don't see a blur. And what actually happens is where your eyes end up fixating is projected backwards in time in your conscious perception to fill up that space. So if you make a saccade to the clock, like the clock that's in this room here, you would actually see the second hand last an extra second or an extra half a second. Benjamin Libet also did an experiment looking at perception where he either stimulated people's index finger or he stimulated the somatosensory cortex over where the index finger sensation is located. And what was very interesting is that in each case, the sensation was delayed by 500 milliseconds. That's a long time, half a second, but it was referred backwards in time so that subjects did not notice the delay. Now, when you add together the sensory delays and motor delays, it means that conscious perception and conscious control of actions are way too slow for all sorts of activities that we human beings do, such as playing improvisational music, playing sports, like hitting a fastball, doing martial arts, etc. We also know that there are patients out there that have impaired conscious perception, but they have intact action. So some of the first of these patients to be described in the literature are patients with blind sight, that in a blind hemifield, when they have no conscious perception, but they're asked to simply point to where they think the stimulus might be, to just sort of guess, they're way above chance. And patients with visual perceptive agnosia, such as this patient here from the literature, when asked to match up a card with a slot, you can see this poor patient D is almost at chance, but when asked them to simply post the card through the slot, they can do it extremely well. And this discrepancy between impaired conscious perception with intact action can be observed in healthy individuals as well through optical illusions. I'm sure you're familiar with these Titchener circles, where if you put the little dots around the circle, it makes it look bigger. You put the big dots around it, it makes it look smaller. Well, you can sort of manipulate these things. And what you find is that people will tell you, oh, this disc is bigger or this disc is smaller, and they'll be wrong. But when you ask them to pick up the disc, their fingers actually modulate to the correct width of the disc. So given all this, how does consciousness contribute to our evolutionary success? Consciousness often occurs after the perception, decision, or action have taken place. It's too slow to participate in many of these real-time events. It can fool us by creating visual and tactile illusions. And we know from both patients and healthy subjects that judgments and actions can occur even with impaired conscious perception. And I actually think one of the most important things is consciousness is difficult to control, right? Mindfulness is hard. Like, that seems very odd if one would be to argue that the purpose of consciousness is to allow us to perform intentional action. So what does it do? How does it contribute to evolutionary success? And the theory that we have is you can explain all of these problems if you view consciousness as a memory system. So Endel Tulving first postulated that episodic memory are the set of processes that allow us to mentally time travel and re-experience a past moment in time. And what we argue in this paper is that consciousness developed with episodic memory to enable this phenomenon of remembering. Consciousness actually binds the disparate elements of an experience together. It provides a medium to replay the memory traces such that our conscious awareness is actually the process of remembering. Okay, now we have known now since 2007 that episodic memory did not develop simply to help us remember information. Episodic memory developed to allow us to flexibly and creatively combine and rearrange memories of prior events to plan for the future. And what we argue is that this is true not just for episodic memory, but all the explicit memory systems. In other words, all the memory systems that involve conscious awareness, and true for consciousness itself. So let me give you an example. Through your sensory memory, you may hear a dog barking. And this sensory memory, which lasts between 0.5 and 2 seconds, is transferred to your working memory, which then goes to your episodic memory and retrieves a memory of when this very same dog chased you off its property just yesterday. Well, it's not difficult to imagine the future, right? This dog is probably going to chase you again. Okay, but why is consciousness important? And for that matter, why is episodic memory important? I mean, can't we just see the dog and let operant conditioning lead us to walk across the street based on that prior experience? Well, the first thing is that consciousness is necessary to remember the event with episodic memory. So why is that important? Well, sometimes, as in this little picture here, the stimuli and setting are similar enough that operant conditioning can work. But sometimes it's actually not the case that the stimuli and setting are going to be good enough for a match with operant conditioning. So we need this conscious ability, this more flexible memory system to do it. Or sometimes the condition response is triggered, but we need to perform a different type of action. Okay, so now I've been equating consciousness with these explicit memory systems, but you might be saying to yourself, yeah, but consciousness does a lot of other things like problem solving and all sorts of things. So how do we get to that? Well, I think it's directly related to this concept that what these explicit memory systems do is they allow us to flexibly and creatively combine memories to imagine the future. So one time we're remembering when we went to a cave, and right outside the cave were these wonderful berries that we picked. But another time we went to pick the berries and we were chased off by a bear. And the problem solving comes in when we think about, okay, we have these two different possible futures, and what can we do to allow one future to occur and try to prevent the other future from occurring? All right, so what? So how does saying that consciousness evolved as part of the episodic memory system, how does that help us understand consciousness? Well, what we argue is that if consciousness evolved as part of the episodic memory system and the other explicit memory systems, there's no reason that it needs to happen in real time. There's no reason that it cannot function properly with a small delay. So what we argue is that when you perceive the world, you don't perceive it directly. We're actually all perceiving the world as a memory. So conscious perception is remembering a sensation. But of course, we don't remember this sensation as raw sensory material by itself, right? We have the raw sensory material as the bottom up and the top down processes on top of it. So our conscious perception is a mashup between these bottom up sensory processes and these top down episodic and semantic memories going on to it. So once we understand that our conscious perception is a memory, then there's no problem with all these order effects, that consciousness is happening after the perception, decision, the action. There's no problem with all those post-dictive effects that I mentioned, because we're simply remembering things that happened in the past. There's no problem with sensation being a brain process being separate from conscious perception. There's no problem with that chronostasis. There's no problem with sensations being delayed for 500 milliseconds and being referred backwards in time. That's what memory does. Memory refers things backwards in time. Okay, so what about these decisions and actions? Well, what we argue is the you who decides and acts is actually unconscious. So your conscious decisions and conscious actions are actually memories of unconscious decisions and unconscious actions. So if that's the case, there's no problem with our motor cortex planning a movement before we consciously decide to move. There's no problem with consciousness being too slow for music, sports, martial arts, etc., because it's not the conscious part of you that's actually making the action happen. So does that mean that we never use our conscious minds to make decisions and guide actions? And I would say, no, absolutely not. As Kahneman and Tversky showed so elegantly in their work exploring our system 1 and system 2, we can use both systems. So system 1 is our fast, unconscious intuition and instinctive reactions that we use, as in this little cartoon here, 95% of the time for all sorts of things that are going on in daily life. But we still have our conscious system 2 processes whenever we have a difficult decision that we need to slow down and think about what is the best decision, what is the best action. And I would simply argue this is the conscious memory system. So to put this in an example, I would argue that you can be working away at your computer, maybe you're sitting at home and you're thirsty, so you get up from your computer, you walk to the kitchen, you grab a glass of water, you fill it up, and you have a drink. I would argue all of those steps could be carried out almost completely unconsciously. You don't need to use conscious effort to plan, how many steps am I going to take as I walk into the kitchen? How much force am I going to put on my fingers when I grasp the knob of the kitchen cabinet door? How much force am I going to do moving my arm to open the door? All of that is happening unconsciously. But if you happen to be in a situation like Katniss Everdeen was in the Hunger Games, and you're trying to get a glass of water and you have to either go through a field of snakes or jump from lava rock to lava rock, and even once you get there, you've got to move your hand through barbed wire to get the water, sure, then you're going to have to use your system 2, your rational thinking, to think through each step and use everything you know to make the right decisions. So again, I think of system 2 as the conscious memory system that helps when decisions and actions are particularly difficult. Okay, so let's go back to William James. So why is it that consciousness feels like this continuous stream when we know the brain is processing things in parallel? Well, I argue that we experience events serially because that is the property of our conscious memory system, to be able to remember. And of course, I believe remembering things is what it means to consciously experience things. And it works serially in time. And once we decouple real-time sensory input from consciousness, then there's no reason they have to be operating in the brain the same way. And I actually think the reason that sometimes it feels like we're actually sort of watching a movie when we're sort of sitting back and watching what we're doing is that the system developed this way to allow information to be imagined in different ways, and we can imagine different possible futures just like we're a movie director moving scenes around on a storyboard. All right, so I want to introduce a metaphor now that explains how I think about our conscious control of decisions and actions. And I'm using a horse and rider example. I think about the horse as like our system one unconscious brain processes. I think about the rider as our conscious system two conscious mind. And the horse is in control of moment-to-moment decisions. And most of the time, the human rider is just going along for the ride. So you don't need to tell a horse how to walk across a rocky field or jump over a small log. The horse does that all by itself. But if you want that horse to go from Carson City to San Francisco, you're going to need a rider there who can help to give this sort of high level control. But ultimately, it's the horse that's actually making the moment-to-moment decisions. Now, how is it that the rider is able to provide this sort of higher level direction to get the horse where it wants to go? Well, the rider has these special sunglasses that can use sensory memory to perceive things from the world, use episodic memory to retrieve prior autobiographical experiences, to use semantic memory to be able to retrieve prior information that has been learned, and to use working memory to keep information in mind and manipulating it. And of course, to flexibly, creatively combine and imagine all these different things to be able to figure out the best way to go. But there's one more piece of this analogy I want to throw in there, which is that the images come from the horse. And it's the fact that the images come from the horse. The horse decides what we are going to be seeing at a moment-to-moment basis. That's why mindfulness is hard, because we as a conscious mind are not directly in control of the contents of our consciousness. Okay, now let's switch gears for a minute and talk about the neuroanatomical correlates of consciousness and disorders of consciousness. So, because I view consciousness as being the same thing as our explicit memory systems, the neural correlates of consciousness are the neural correlates of explicit memory. So what are those? Well, hippocampus, of course, and other medial temporal lobe structures. Papes circuit, also part of the episodic memory system. Inferior lateral temporal cortex is critical for semantic memory. Frontal and parietal cortex are critical for working memory. We know the default mode network is critical for this type of memory processing as well. But is there any more? And the answer is that I think that Murray, Wise, Baldwin, and Graham had it completely correct when they argued in their book that every cortical area contributes to memory, each in a specialized way. And what we argue is that every cortical region contributes to memory and a specific domain of conscious awareness. So visual areas are important for visual consciousness, auditory cortex for auditory consciousness, parietal for awareness of space, somatosensory for that, the motor cortex for being aware of fine motor movements, frontal eye fields for movements of the eyes, Broca's area is important for awareness of speech, insular cortex for awareness of your body, prefrontal cortex, of course, for doing all sorts of high-level types of activity. So when patients have damage to the hippocampus, they're impaired, as you all know. They have trouble imagining the future. They can't update their sense of self. Patients with bilateral occipital injury, they lose awareness of visual perception. Patients that have temporal lesions, depending upon where it is, if it's auditory cortex, they can have sort of an analogy to blind sight where they don't consciously hear sounds but can still react to them. Patients with semantic variant primary progressive aphasia actually lose the concepts of words and then ultimately the concepts of the objects themselves. Of course, patients with frontal lobe damage can have difficulty with conscious control of their limbs and conscious control of their behavior. Patients with parietal cortex damage can develop neglect, lose awareness of half of space. So in brief, we argued that all these cortical areas support consciousness, but none are absolutely critical or essential. So I view consciousness as being in sort of modules, and each module can be damaged, but the other modules can still have conscious awareness. I think subcortical structures are certainly necessary for consciousness. We know the reticular activating system is important, but I don't think any of them are sufficient for consciousness. I think you need the cortex. I do think subcortical structures are likely to be the hub of what can switch your conscious awareness, for example, of focusing on your breath if you're practicing mindfulness, to hearing the car, honk, or feeling your bladder calling, or whatever it is. And I think it may be intralaminar nuclei of the thalamus, but more work needs to be done on that. All right. So now that I've presented to you this wild theory about consciousness, let's talk about some of the implications. Are animals conscious? And if so, which ones? Well, I presented to you the neuroanatomical localization of consciousness as the parts that are important with memory, which includes hippocampus and the cortex. And all vertebrates have hippocampus and cortex or analogous structures. So just from that logic, I would argue that all vertebrates have consciousness likely on a spectrum. I certainly think something like fish may only have conscious awareness of basic emotions, but I think they could still feel pain and feel happiness and things like that. I want to say that our theory does not say that animals without a backbone are unconscious. It just doesn't say anything one way or another, okay, about it. Now, what about neurologic disorders? I think there's lots of neurologic disorders that are disorders of consciousness. They're the disorders that affect the cortex. This includes epilepsy, migrainous phenomenon. People have migraine auras, I think, are disorders of consciousness. Strokes and other cortical lesions, I think, disrupt consciousness as like neglect and other problems. I think Alzheimer's disease and cortical dementias, all these patients I see in my clinic every day, I think I'm basically watching consciousness be disrupted and disappear week after week, month after month, year after year. And I think ultimately my patients end up in a delirious state, which I think is them basically being awake, but unconscious. I also think there are psychiatric disorders of consciousness, and I'd love to engage in discussion about whether people agree or disagree with this. I think dissociative disorders are disorders of consciousness. And I would speculate that schizophrenia, and I should say I'm not the only one to speculate that schizophrenia is a disorder of consciousness, but it makes sense to me that it's also a disorder of consciousness. And we have developmental disorders as well. And I do feel in bringing up developmental disorders, because I think it's somewhat controversial, that I do have anecdotal experience here, because my son, who is 23 now, actually has severe classic Kanner autism. And what I observed in him and individuals like him, his colleagues, both when he was growing up and now at a group home, basically these individuals learn through operant conditioning, which is called applied behavior analysis. They don't learn in the typical way. And I do think that their consciousness is disrupted. I think thinking about this type of severe autism in this way helps to explain a lot of the mysteries about it. Okay, now what about implications for the rest of us? So, I've argued that our decisions and actions are mostly unconscious. And, maybe you won't argue with me too much if I said, you can go through your morning routine, brushing your teeth, going for a shower, getting dressed, pretty much in an automatic, unconscious way. But, what about like if you're in the middle of a meeting, like Is it really possible that your actions and decisions are actually unconscious? And I would argue that it absolutely is possible. And I bet each and every one of you have had a situation where you said something at a meeting and you said to yourself, I didn't even know I really thought about it like that. Or you said, now, why did I say that when I really think the other thing? And I think the answer is illustrated by this wonderful experiment. Some of you may know that Michael Gazzaniga did actually when he was a graduate student many, many years ago. He looked at patients with Roger Sperry, his mentor, who had their corpus callosum transected, so the connections between the left and right hemisphere. And then these individuals were flashed images on either the left or the right side of the screen. And when they flashed the chicken leg to the right side of the screen, the instructions were to then point to the array of picture that best went with what was flashed. And the verbal left hemisphere recognizes this chicken foot, and the verbal left hemisphere, and the right hand points to the chicken head. Then a snowy scene is flashed on the left visual field, goes to the nonverbal right hemisphere, but the left hand correctly points to the shovel as going along with that scene. But then the interesting thing is the individual is then asked, why did you point to the shovel? And the verbal left hemisphere gives the answer, well, you need the shovel to clean out the chicken coop. Okay, so it's a plausible explanation, but it's actually wrong. That's not the reason. And Nisbet and Wilson, more than 60 years ago, showed us that this happens with healthy individuals as well. That people are often unaware of the existence of a stimulus that influenced their response. They're unaware of the existence of a response, that they made a response, or they're unaware that the stimulus affected their response. And I think that this theory helps to explain so much of human behavior. It explains why people have difficulty controlling their behaviors. You may be watching yourself. This happens to me sometimes, as I go to dip my spoon into the chocolate ice cream. I'm like, I shouldn't be eating this. I should put the container back in the freezer, so this gets at a question like, well, who are you anyways? And of course, I think you're both your conscious mind and your unconscious brain processes. I would actually argue that it's your unconscious brain processes that determine your personality and your character. This is the part of you that's happening at an automatic instinctual level all the time. So when we interact with somebody and we are showing facial expressions and body language, all of this is happening unconsciously, and that's really what determines our personality and our character. So most people all day long, they're really interacting most of the time with our unconscious self. But when we, as a conscious mind, think about ourselves, we think of ourselves as a conscious self. So it's a very interesting discrepancy. All right, so do we have free will? Everybody wants to know, am I saying we have no free will? I absolutely positively think that we have free will. And as Kahneman and Tversky said, all you have to do to use your conscious system 2 processes is slow down and take a minute or two before you make the decision. And then you're able to use your conscious mind to make the best decisions. Okay, so can you change who you are? And of course, I think you can use your conscious mind to alter your behaviors or habits and even some of your underlying personality traits. What I would argue is you need to use your system 2 processes, your conscious mind, to do it. And that might mean you need to work hard at making these changes. You need to implement strategies, for example, to do these things. And by practicing new behaviors, by using your conscious mind to make changes, you can do it. And I think everything that I've said, and I think everything in this talk, is completely consistent with cognitive behavioral therapy. And I think CBT works if you believe it works. I think it does, because it directly addresses both the conscious mind and the unconscious brain processes using techniques that each can understand. And I actually want to illustrate this with education for a minute. So if one is trying to teach learners of any age or stage of career, you want to think about teaching the learners with the right techniques so that you'll influence the brain systems that you want to do. So when you're memorizing information, that's using episodic memory. When you're thinking and discussing the information, using working memory. When you incorporate it into your knowledge base, it's semantic memory. And when you use effort, it's going to help one to remember things better. My colleague and I, Elizabeth Kensinger, in our book, Why We Forget and How to Remember Better, The Science Behind Memory, we introduced this little mnemonic of FOUR, F-O-U-R, to do 4 things to help learners remember things better: focus on the material, organize the material, understand the material, and relate the material to what they already know. So the point here of this slide is you can sort of use about how different things are learned in different ways from a practical standpoint during education. And of course, if we're going to be teaching procedural skills, and it doesn't have to be surgery, although that's sort of the classic example, you want to do it through procedural memory. Now, what about learning things like ethics? Or how do you learn how a patient feels? Well, I would argue that if you're trying to help your learners understand the way a patient is feeling, it is not adequate to simply talk about something like that or to read it out of a book. You need to be able to actually teach the unconscious, implicit memory systems and other processes to be able to understand it, because that is where those things operate. So role playing would be the way that you would teach those types of techniques. All right, so let's say you want to actually work on being able to control your conscious mind and control your unconscious brain processes. Well, the first thing that I recommend is that you work on controlling your thoughts by practicing mindfulness. And once you get a handle on your conscious mind, then you can start to develop strategies and techniques and tools to change your unconscious brain to then make decisions and actions that you consciously desire. So there's a lot of different ways that you can also unlock the power of your unconscious self. In other words, what I mean is that we have these unconscious brain processes going on. And so the idea is, well, how do we tap into them so we can learn more? By simply reviewing material before you go to sleep, you can actually use unconscious processes while you're sleeping to help you retain that information better. You can bring unconscious processes to conscious awareness. So we are often, especially as psychiatrists, right, aware when the person sitting across from us are scared or angry or sad, excited or happy. And with a little bit of training, often by looking at our own emotions and reactions, and I think it's wonderful psychiatrists are trained in these things, we can do better at picking up more subtle emotional states such as when individuals are bluffing or lying or manipulating or seducing or protecting, etc. And of course, something that's very important in our society today is to work on bringing unconscious biases and stereotypes to our conscious awareness. I think that people use both their conscious mind and their unconscious brain processes together in spectacular and wonderful ways. I think that being in the zone often means letting your unconscious processes have full reign. And many top athletes and musicians, I think, really demonstrate a wonderful synergy of letting their unconscious reign, but then if it's not working, use conscious top-down processes to modify what they're doing to either produce the best music, the best performance in sports, etc. And then finally, I think that some of the best art and aesthetics come from this combination of conscious and unconscious processes. I think many creative insights arise from sort of these unconscious brain processes being prepared with consciously struggling with problems, which is in fact how I think that my insight about consciousness actually being a memory system came about. So thank you very much, and I'm very happy to answer any questions.
Thank you very much. I had a question.
Please.
There's this phenomenon that you actually alluded to in neurology called anosognosia. And we have it also in psychiatry, particularly in people who have schizophrenia or bipolar disorder, this lack of awareness that a person is ill. Do you have any thoughts on what that might be?
Yeah, I mean, from a neuroanatomical standpoint, what we typically observe is that people are anosygnosic when the main part of the brain that would be producing the conscious awareness is damaged. So individuals with Anton's syndrome are cortically blind from bilateral occipital injuries, but they typically deny that they're blind. Individuals with right parietal damage are often unaware of the left side of space. And many of these individuals are also blind in the left side of space, but deny that they have any of these problems. And it actually comes down to sort of my believing that consciousness, or my understanding that consciousness is in modules. And the conscious module that enables that type of conscious awareness is also the part that would be aware of itself. And so when that is damaged enough, it loses that part. Now, how do I take it from those neurologic examples that I feel rather comfortable with and explain, say, schizophrenia or bipolar? I would have to think that it would be related to either problems with the insula that does a lot of sort of self-monitoring, or with a sort of frontal lobe, metacognitive situation. It's certainly interesting. My patients with behavioral variant frontotemporal dementia are, almost 100%. I mean, I can't think of anybody, that I diagnosed with that was not also anosygnosic, that they felt there was nothing wrong with them. In fact, it's one of the things I teach the residents and fellows, that if the person is coming in complaining of cognitive problems, it's highly unlikely they're going to have behavioral variant frontotemporal dementia. So I think most likely for the psychiatric patient populations you mentioned, it would be due to the frontal lobe normal metacognitive monitoring that's damaged.
Other questions? I also have some on Zoom.
Yeah, if you shout out your question, I'll
but the
repeat it.
Zoom people can't.
Okay.
Hi. So I had a question about intrusive thoughts, like particularly ones that are ego dystonic.
Yeah.
How is that explained between the unconscious and conscious mind?
Absolutely. So that's a great question, right? So that is this that's the horse, right? So that is the fact that our the things that are presented to our conscious mind are driven by our unconscious. And so what that's saying, and of course I see this in my veterans, you know, that have PTSD and have all sorts of intrusive thoughts and images. It's that, you know, our unconscious brain processes are saying, this is important. You need to pay attention, you know, to this. And, you know, I do mindfulness 12 minutes each morning. And I actually find one of the things so useful about it is it helps me to realize, because of intrusive thoughts, things that may be bothering me that I might not have been consciously aware of, or maybe they're bothering me. Maybe I was aware of them, but I didn't realize the extent to which they were upsetting me or disturbing me, or, you know, things I need to deal with, or something like that. So this is how I view is the cause of these intrusive thoughts. And I think that by working on practicing mindfulness, and there actually is a lot of evidence, some of them from functional neuroimaging studies, that mindfulness is a skill. It's something that can be learned like any other skills, and that people can get better at being able to, you know, let intrusive thoughts, you know, sort of go to the side and not be crowding your mind when you're trying to think of it. Thank
I have
you
a
for
couple
the good question.
Couple of questions on Zoom.
Yes.
How might this be applied to impulsivities such as with suicide prevention? If we can add more time, for example, lethal means safety for consciousness processing, perhaps that is what helps save lives, overcoming the unconscious processing of the
No,
the momentarily acute sadness, distress.
yeah. No, I think that's a great thought. And, you know, I think, you know, the way to do it is to get people to the key is that it has to become part of the procedure. So there would need to be a way that instead of the feelings of sadness to trigger an action that is going towards suicide, they need to be a way to trigger instead the ability to take a step back, take a deep breath, and think consciously about what to do. But I think that's a wonderful potential project to try to do that.
I had a question about moral decision making.
Yeah.
So like you have the trolley problem where you kill one person instead of a group of people. But if you were to directly kill one person versus switching the trolley, like there's a lot of moral decision making experiments that show a lot of emotional decision making in that. How does that account for the system 1, system 2 horse and rider analogy?
Yeah. So I like that a lot. So let me tell you what I first know about the trolley problem. So, you know, it's interesting that, you know, many people, yeah. So here's the answer. So many people, when asked if you had to pull a lever that would, you know, divert the trolley, so instead of killing 5 people, it would only kill 1, you know, many people would pull that lever. Whereas if you said, well, to stop the trolley from killing 5 people, you had to push the person in front of the trolley, most people would not do that, even though from a system 2 conscious, rational decision, it's the same. But the difference is that from an unconscious brain processes perspective, it feels very different when you're actually physically, having to push someone, right? Our unconscious brain processes say, we don't want to do that. We don't want to be pushing someone and actively killing someone, even though that from both an intention and an outcome, we're killing someone either way. So I actually think that this is a perfect example of how we can explain why is it that it's so aversive to us to push someone, into the path of the trolley, but less aversive, not aversive, but less aversive to pull the lever to move the trolley from one track to the other, because in pulling the lever, it's mainly the system 2 processes that are making that decision, versus like pushing someone, it's our system 1 automatic unconscious processes that say we can't do that, that's forbidden.
Thank you so much for this presentation. In one of the figures, the system 2 conscious rational thought was described as, possibly being lazy. I was wondering what that might mean and why our consciousness would want or benefit from being lazy.
Yeah, so I will say I didn't make this little cartoon. I have the little reference down here, that I took it from the internet. But I think basically what it means is that it takes effort to step back and use our system 2 conscious processes. And I think that's all it is really meant, that we don't always feel like using it. And if we're tired or we're hungry or, we're frustrated, we tend not to bother with it. And we use our fast, instinctual, automatic processes.
I was thinking about how this relates to anxiety disorders, and I feel like there are go with the flow people, and then there are people who are kind of constantly trying to make these changes. And it was having me think of like trust and mistrust of your system 1 thinking and how that plays into anxiety disorders. And I had wondered if anyone had any kind of similar.
Yeah, no, I think that totally makes sense, and I think it would be a helpful explanation. And I probably should have said at the beginning that this, I would love to work to sort of show how these ideas are relevant for all types of different disorders. And if anybody wanted to collaborate on a paper on sort of talking about how this theory might be relevant or not relevant for a certain psychiatric disorder like anxiety, I'd love to collaborate with you on that.
You have 2 quick questions, which I think are quick questions. Are authors like J.K. Rowling or J.R.R. Tolkien who create imaginary worlds using system 1 or system 2?
Oh, absolutely. Yeah, absolutely both. They're absolutely both. I've actually thought about those authors in particular. They're 2 of my favorite authors. And J.K. Rowling actually talked about her basically, really the whole Harry Potter character came to her, from, sort of fully formed almost, I think when she was on a train. And so I think that's evidence that unconscious brain processes sort of brought it up. But there's no doubt that the entire story, was very carefully constructed and written out. And there was a exhibit, I'm sure it's long gone, that was at the New York library, the main library with the lions, like in the front of it in New York City, that actually had a lot of her original sort of notes and manuscripts, and in a very careful way, she mapped out, all 7 books and the Horcruxes and things like that. So I think it's both, and I think it's the same for Tolkien. The one thing I'll say about Tolkien, which I think is well known, is he fought in World War I, and people had asked if his book was allegory. And he said, no, it's not allegory, meaning like I'm not trying to tell the story of World War I and, World War II and things like that, from, in this book. But he's like, but I have no doubt that my experiences in World War I, shaped who I am, shaped the writer, who I am.
So the last question we have time for is, why 12 minutes of mindfulness? And I don't understand if the people asking the question think it's too little or too much.
Yeah.
Maybe know.
Well, it's a good question. Is it too little or too much? Many practitioners of mindfulness will say that 20 minutes is the minimum that you should spend doing it a day. I will say in my day, 12 minutes feels right. It's the amount of time that I have been able to do. I will proudly say for over 14 years now. But I feel more than that would be sort of like self-indulgent,
Very, very interesting. Thank you very much.
Thanks so much for having me.